Now, Dr. Bob Gill is, as the name suggests, a medical practitioner of note, but he's also the most indefatigable campaigner to save the National Health Service that was the jewel in our crown, but is being deliberately tarnished by the Tories in order to abolish it. At least that's my point of view. Let's hear if it's his. Dr. Bob Gill, welcome to the show.
Hello, George. Thank you for having me on.
What do you say to my thesis that this is all deliberate? They want people to conclude that the state of hopelessness in the NHS is so great that we can no longer continue with it in its present form.
Well, it's exactly spot on. This stage of the NHS privatisation requires the NHS to fail. It's very hard to convince the public to abandon a system which has worked very well for 60 plus years and switch to an American-style insurance system when it's working well. So the government, over years of defunding, understaffing, cutting of beds, have led up to a situation where people are not getting the treatment or the assessment they need. And I see this on a daily, if not weekly basis in my surgery, where my patients are just not getting admitted when they're sick. They bounce back, they end up back home, and I attempt to send them back in again. So your thesis is spot on.
The crisis is because of the £4.5 billion cut to social care, isn't it?
Yeah.
The social care cuts mean that people who were being looked after at home and outside of hospitals have nowhere to go but the hospitals. And that's what's made a situation that was bad in any case into an emergency.
That is a significant factor. You've also got 600 plus GP surgeries have shut since 2010. We've lost 7,000 hospital beds in that time. We're having a hemorrhaging of staff. Experienced staff have basically had enough. They knew what the NHS was like and could be like, and they're not prepared to put up with the current regime, and they've walked. So you've got a staffing crisis, you've got a bed crisis, and you've got a social services crisis, all cleverly designed to explode. But what the government haven't managed to do is to control all the messaging. And to his credit, Mike Adamson of the British Red Cross last weekend described what the staff know from their own experience. This is a humanitarian crisis, but it's been a crisis that's been building over the last 2 or 3 years. And unfortunately, the bad headlines that the government want to see, they want to see bad headlines, but they want to control the conclusion that people will come to. And the narrative is we're blaming it on an elderly population. We're blaming it on immigrants. So they've set up the scapegoats, and with this narrative, they will break down the trust in the NHS, the faith in the NHS, and also break down social cohesion and solidarity. And this is the game playing.
The news, for it is news to me, that we've got 7,000 fewer beds for a larger population, and by definition an aging population, will come as a great shock to many people. And when the Red Cross described this as a humanitarian emergency, and when the Red Cross said that they were coming to the rescue of the British National Health Service, the 5th or 6th largest economy in the world, an organization that normally comes to the assistance of people in disaster zones, why wasn't that turned into a bigger indictment against the government? Why are people not seeing as clearly as they need to why this is being done and who's doing it?
Because we've been subjected to a very clever and long-term propaganda softening up, because most people's conclusion will be it's just the time of year, or, you know, people are getting older. This is a narrative. We've been primed to believe the narrative. I saw a report on the BBC this week talking about the crisis. They gave no analysis of the bed reduction and simply blamed it on an older population and bed blocking. You know, this is what we've been set up to believe. Blame the patient, blame the staff, blame the system. But, you know, the figures are worse. Compared to other countries in Europe, we have half the number of beds per head of population compared to Germany and France. Since the 1980s, we've lost 50% of our hospital beds, and we've lost the hospitals themselves. So, you know, we've been softened up and very gradually brought to this situation. But we're also seeing this fake blame game between Simon Stevens, who is the head of the NHS England, and Jeremy Hunt and the government. But actually, they're completely aligned. Simon Stevens, formerly of United Health, one of the biggest American private insurers, he spent 10 years at United Health, and he's taking us into the phase of the American insurance conversion.
So he's actually an accomplice of Jeremy Hunt.
He's running the show. Since the 2012 Health and Social Care Act, the Secretary of State can only issue a mandate, an instruction, once a year. He has no day-to-day control over the NHS. That has been handed over to the head of NHS England, which is Simon Stevens. So the arguments calling Hunt must go, we're directing the attention at the wrong target. The target needs to be Simon Stevens, Mr. Insurance Man, Mr. United Health, who I have no doubt might be going through the revolving door back to United Health once the job's done in England.
Now, remind me, who's the Labour NHS spokesperson now, and what are they saying about it?
Now, the name escapes me. Formerly it was Heidi Alexander, but the narrative coming from the Shadow Health team is slightly better, but they're not painting the picture that I've just painted. And you've got to ask yourself, why not? This would be a vote winner. If Labour put their hands up and said we spent 13 years teeing up the current situation, we carried on Thatcher's plan for the privatisation, we've made a huge mistake, we regret it, and now we're warning you that this is where it's going. And Labour need to do this.
One of the Blairite MPs, I forget her name too, she said that Labour should stop seeking to exploit the crisis in the NHS.
Exploit wouldn't be the word I would use. I would say warn and raise awareness. But if they're only using it to bash the government, but the end game is the same, well, that's to be condemned. If they're genuinely interested in preserving the best thing about this country, the best functioning health system in the world, it could be most efficient, then they need to come clean and confess their sins over the NHS and say we're going to detoxify the NHS, remove the market, and spend as much money of the NHS budget on patient care. We don't need a tax rise. We just need to stop the hemorrhage, which is going to private finance initiative, which is being spent on all the management consultants and all the marketisation, which is taking nearly a third of the NHS budget is being spent on preparing for the privatisation.
Now, finally, how do people see your wonderful film, The Great NHS Heist?
Right, so The Great NHS Heist is in production. We've been over to the United States. We're crowdfunding it on GoFundMe, and we're sort of halfway through the filming stage, and we're hoping to get it out in the next couple of months. It will probably be on YouTube. We haven't quite finalised how we're going to get it out, but certainly we need all the help we can get to explain and provide the evidence for this complex deception, which in my book is the greatest betrayal of the public interest.
Dr. Bob Gill, thank you very much indeed. Coming up after the break, your